All right, hello, Ms. Drummond. My name is Abby Berkshire, and I will be your student nurse today. We will be doing a head-to-toe physical assessment. It'll take about 30 to 40 minutes. Do you need to use the restroom before we begin?
No, thanks.
Okay, can I see your hospital ID bracelet, please? Okay, can you tell me your first and last name and your date of birth?
Colby Drummond, May 10th, 2002.
Okay, perfect. So we're just going to go ahead and begin. Your hygiene is good. You appear to be well-groomed and clean. I do not detect any odors. Your behavior is appropriate for this situation. You appear to be your stated age with a normal height and body fat distribution for your stated gender and age. I do not see any signs of distress, no physical deformities or any obvious lesions. Your skin overall looks peach in color. It looks smooth, even, and consistent throughout. Your facial features are relaxed. You are sitting comfortably erect. Your position is relaxed, and you seem calm and willing to participate and cooperate throughout this physical assessment. I saw you walk in this morning with a smooth gait with no assistance needed. So with that said, I'm gonna go ahead and assess your mobility. So can you stand up for me?
Yeah.
Okay, I'm just gonna have you walk to that curtain and straight back. Okay, perfect. So you were able to rise from a seated position easily, and your gait was smooth and even. So now I'm going to assess your balance while you're standing with the wrong vertex. What I'm going to have you do is stand with your arms straight by your side, feet together, and close your eyes. Okay. Perfect. I do not detect any excessive swing. You can open your eyes and go ahead and take a sit back down. So now we're going to begin with the mental assessment. Can you tell me your name again, where you are, and what day of the week it is?
Colby Drummond, today is Friday, and I'm at Mason Hall Hospital.
Okay, perfect. So you are alert, your level of consciousness is intact. You are alert and oriented ×3 to person, place, and time. So I'm going to assess your abstract reasoning and judgment. So if you were to see a house on fire, what would you do?
Call 911.
Okay, perfect. So judgment and abstract reasoning is intact. So now normally I would go ahead and take your vital signs. I would take your O2 sat. I would take your oral temperature, your respiration rate, your blood pressure, and your radial pulses. But today we're just going to go ahead and start with the head-to-toe assessment. So your head is midline, it is symmetrical, and I do not see any lesions or deformities. Your facial features are also symmetric. Your skin is peach, and it feels smooth to the touch, and even your skull is round and it is symmetrical. So I'm going to go ahead and palpate your skull for any pain or tenderness. Do you have any pain or tenderness as I'm doing this?
Nope.
Okay, perfect. Your skull feels round. It feels smooth and symmetrical. Both your hair and scalp are healthy and intact. I did not note any infestations or nests. Your hair felt smooth, healthy, and clean. So perfect. So we're going to move on to your eyes. So your eyes are symmetrical. I do not see any lesions on your eyelashes or your eyelids. Your eyelashes curl up and out, and your bottom lashes curl down and out. Your eyebrows are symmetric as well. They move up and down symmetrically with your facial expressions. Okay, so I'm just going to go ahead and take a look at your conjunctiva and your sclera. Okay, your conjunctiva is clear, sclera is white, and I can see small red vessels in your eye. So I'm going to test your, assess your pupil size. Okay, so your pupils are about 5 millimeters bilaterally, and they are also round bilaterally. I'm going to do a pupillary light reflex. So what I'm going to do is just shine a bright light in your eye, and you're just going to look straight at me. Okay. Okay, pupils both constricted bilaterally, directly, and consensually. So what we're going to do next is an accommodation test. So what I'm going to have you do is look straight into my finger and back to this wall. Okay, look to my finger and then look to the wall and look back to my finger. Perfect. So pupils both constricted bilaterally when looking at a closer object such as my finger. So the accommodation test is passed. We are now going to do red reflex. So I'm going If you could take your glasses off for me, please, and just look straight at me, please. Okay. Perfect. Red reflex was present in both eyes. Okay. So now we're going to move on to your nose. So your nose is symmetrical. It is midline. I do not see any inflammation or swelling. I'm going to go ahead and take a look. So if you can look up for me. Okay, your septum is midline. Your mucosa is pink and moist. I see fine hairs present. Your turbinates are reddish pink with no swelling. I do not see any abnormal discharge or bleeding. I'm now going to assess your patency of your nostrils. So that's just a sniff test. So if you could close one nostril and sniff in. And the other one. Perfect. Patency is observed in both nostrils. Okay. So now we are going to move on to your mouth. So your mouth is midline. It is symmetrical. Your lips are pink and moist. If you could smile for me, please. Okay, your teeth are intact. They are clean. They are white and evenly spaced. I'm now going to use this tongue depressor to kind of look around. So if you could open your mouth again. Okay, your mucosa, buccal mucosa, and gums are all pink and moist. Your tongue is pink and moist. I see taste buds. Can you touch your tongue to the roof of your mouth? Okay, I see smooth and I see blue vessels. You can put your tongue back down. Your posterior pharynx is intact. Your hard and soft palates are pink and intact as well. Your tonsils are pink and glistening. I do not see any swelling. Can you say ah for me? Ah. Okay, your uvula is midline and it rises and falls. So perfect. Okay, you're now going to move on to your ears. So your ears are symmetrical. They're equal in size. Do not see any swelling. I'm going to go ahead and palpate them for pain or tenderness. I'm going to palpate your pinna, your tragus, and your mastoid process. Did you feel any pain or tenderness at all?
Nope.
Okay, perfect. So now what I'm going to do is perform a whisper test. So I'm going to have you cover one ear, and on the opposite side, I'm going to whisper 3 random letters or words, and you're just going to repeat them back to me. So cover one ear, please. Tissue, light bulb.
Tissue, light bulb.
Sink.
Sink.
Perfect. Computer, curtain, shoe.
Computer, curtain, shoe.
Perfect. So whisper test was passed bilaterally in both ears. Okay. So now what you're going to do is I'm going to assess your neck. Okay. So your neck is symmetrical. It is peach in color. It's consistent with the rest of your body color. I do not see any jugular vein distension. I'm going to go ahead and palpate your trachea. Okay, your trachea is midline. I do not note any deviation. I'm going to assess your swallowing, so just take a small sip and look up when you swallow for me. Okay, perfect. So I did not notice any difficulty swallowing. I'm now going to palpate your carotid arteries. Okay. Okay, carotid arteries were both palpable, bilateral with a regular rhythm and a +2 amplitude. I'm now going to listen with my with the bell of my stethoscope for grooves in both carotid arteries. Okay, perfect. No breweries were heard. So I'm now going to palpate your lymph nodes of your head, neck, and upper extremities. Okay, so we have your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, or superficial cervical, posterior cervical, deep cervical chain, and if you can just raise your shoulders up for me, and then we have supraclavicular. Did you feel any pain or tenderness at all?
Nope.
Okay, perfect. I did not feel any, none were palpable. I didn't feel any enlargement. So now I'm gonna palpate your lymph nodes of your upper extremity, so just kind of raise your arms out for me. Okay, so I have your pectoral, your tonsillar, or your central lateral, subscapular, and then infraclavicular. Okay, do you feel any pain or tenderness at all?
No.
Okay, perfect. I did not feel any enlarged nose, none were palpable, so perfect. Okay, we are now going to move on to your upper extremity. So your arms are peach in color. They're equal bilaterally in size. They're warm and smooth to the touch. Okay, perfect. If you can, hold your hands out. I'm going to check your capillary refill on both fingers. Okay, capillary refill is occurring in less than 2 seconds. I'm going to look for any clubbing. Your nail angle seems to be less than 160 degrees. Okay, perfect. I'm going to palpate your radial and brachial arteries, so just lay your hands down like this for me. Okay, both radial pulses were palpable with a regular rhythm and a +2 amplitude. I'm going to palpate your brachial arteries now. Okay, perfect. Both brachial arteries are palpable with a regular rhythm and a +2 amplitude. I'm now going to assess the range of motion of your joints. So if you could just wiggle your fingers for me, roll your wrist, flex and extend your elbows, raise your shoulders, and then pretend you're combing big hair. Perfect. Full range of motion of all the joints of the upper extremities. I'm now going to assess strength. So what I'm going to have you do is just raise your arms up and just go against my resistance. Good. Okay, push up. Up. Perfect. Okay. Strength is a 5 out of 5 of the upper extremities. Okay. So now we are going to move on to your posterior chest. So if you could just face this wall for me, please. I'm going to untie your gown. Okay, so your posterior chest is peach in color. It is smooth to the touch. It is warm and dry. I do not see any obvious lesions or deformities. I'm going to palpate your spinous processes. Let me know if you have any pain or tenderness. Okay. Do you have any pain or tenderness?
No.
Okay, your spinous processes were in a straight line. I'm now going to palpate your paravertebral muscles. Okay, did you have any pain or tenderness?
No.
Okay, perfect. The paravertebral muscles are firm and intact. Your AP diameter is about a 2-to-1 ratio, which is normal. That is good. I'm going to assess your respiratory expansion. So I'm going to put my hands right here, and I'm just going to have you breathe. Take a deep breath in and out. Okay, chest expanded equally bilaterally. I'm now going to listen to 10 areas on your posterior chest for lung sounds. If you could, whenever I touch my stethoscope to your back, if you could just take a deep breath in and out, keep your mouth open, please. Okay, perfect. All lung sounds were clear with no adventition sounds. Okay, I'm now going to, you can turn back around and face me. I'm going to inspect your anterior chest. If you could just kind of roll your gown down and kind of hold it up like a tube top. Perfect. Okay, so your anterior chest, it is peach in color. It is warm and smooth to the touch. I do not notice any obvious lesions or physical deformities. So I'm gonna do respiratory expansion again, just like I did on your posterior. So just take a deep breath in and out. Okay, perfect. Lung expansion was equal bilaterally. I did not notice any retractions or bulging. Breathing was even and it looked effortlessly. So now I'm going to listen just like I did on posterior chest, on your anterior chest in 8 areas. So same thing, whenever my stethoscope touches your chest, just take a deep breath in and out with your mouth open. Okay, so what I'm gonna have you do is just kind of bring one arm down to listen under the breast, and you can hold this one up if you would like. Okay, perfect. You can just do that same thing. Take a deep breath in and out. All right, perfect. All along sounds were clear and even bilaterally. I did not hear any adventitious sounds. So something else that I would like to inspect in the posterior spine is, can you stand up for me, please? I'm going to have you face this way and kind of bend down and touch your toes. You can leave your arms dangling. I'm going to look for any abnormal curvature of the spine, which I do not see. You can stand back up. No scoliosis is noted. Okay. I'm also going to assess your range of motion of your spine. So if you could just lean side to side, perfect, forward and backwards, and then just kind of rotate. Perfect, full range of motion of the spine is noted. You can go ahead and take a seat. Okay, we are now going to move on to the precordial area, which is just your heart area. So you can go ahead and lay down for me. This up, and I'm just going to raise the head of the bed up if that's okay. And this. Okay, let's see if that's good. Okay, I'm now going to palpate your precordial area for any lifts, heaves, or thrills. If you can just bring that down just a little bit. Perfect. I'm going to palpate the base of your heart. Okay, the left sternal border, and then the apex of your heart. So I'm just gonna lift the breast up a little bit. Okay, perfect. The PMI is palpable with the regular rhythm and a +2 amplitude, and I did not notice any lifts, heaves, or thrills. Okay, I'm now going to listen to 5 areas of your heart. I'm gonna listen to the aortic region, which is in the second intercostal space, right sternal border, your pulmonic area, which is also in the second intercostal space, left sternal border, your Erb's point, which is in the third intercostal space, left sternal border, tricuspid area, which is in the fourth intercostal space, left sternal border, and then your mitral/apical area, which is in your fifth intercostal space, left midclavicular line. So you don't need to take deep breaths in and out or anything. I just need you to relax, please. I'm just gonna lift this up a little bit. Okay, now I'm just gonna listen here for a full minute for your apical impulse. So your apical impulse was 68 beats per minute with a regular rhythm. I am now going to listen to, or for bruise, with the bell of my stethoscope in those same 5 areas. Okay. No breweries were heard in either 5 areas. S1 and S2, when I listen with my diaphragm, were heard in all 4 areas, okay? So I'm just going to have you pull this back up, your gown, and have you pull this part up and flex your knees just a little bit. Perfect. I'm also going to lower this.
Turn the feet.
There we go. Okay, so now I'm going to assess your abdomen. Okay. So your abdomen is peach in color. It is warm and smooth to the touch. I do not see any abnormal pulsations or movement. I do not see any paralysis. So now I'm going, and your contour of your abdomen is flat. I am now going to auscultate for bowel sounds in all 4 quadrants. Okay. All bowel sounds were present in all 4 quadrants. I'm now going to percuss in those same 4 areas. Okay, perfect. Tympani was heard throughout percussion in all 4 areas. I'm now going to palpate just slightly for some pain or tenderness, okay? Do you have any pain or tenderness? Any pain or tenderness?
Mm-hmm.
Any pain or tenderness? Any pain or tenderness? Okay, perfect. I'm going to go just a little bit deeper.
Okay.
Any pain or tenderness?
No. 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 No.
Okay, perfect. I did not detect any lumps or masses. I'm going to palpate your aortic pulse now as well. Okay, I'm not. Aortic pulse is not palpable. I'm also going to palpate your femoral pulses real quick. Okay. Okay, both femoral pulses are palpable with a regular rhythm and a +2 amplitude. So now I'm going to assess for rebound tenderness. So what I'm going to do is I'm going to press right here. You're going to tell me if you have any pain or tenderness, and then when I let go, you're going to let me know if you have any pain or tenderness, okay? So do you have any pain or tenderness?
No.
What about now?
No.
Okay, perfect. No rebound tenderness is noted. And I'm going to walk over to the other side and assess your liver border, okay? Okay, so what I'm going to do is I'm just going to use what's called the hooking technique. So I'm going to put my fingers kind of under your rib cage. I'm just going to have you take a deep breath in and out.
Okay.
Okay, liver border is not palpable. Okay, I think that is it for the abdomen. You can sit back up and bring your legs over to this side, just as you were sitting before. So now I'm going to assess your lower extremities. They appear to be equal in size. I see no atrophy, no obvious lesions or deformities. They are peach in color. They're warm to the touch. Your feet are just a little bit cooler, but that's normal. I'm gonna check your turgor. Okay, I do not see any tinting. Capillary refill. Okay, this is occurring in less than 2 seconds. I'm gonna assess for some edema. Okay, no edema is noted. Do not see any varicose veins either. I'm gonna assess your joint range of motion in the lower extremity. So if you could wiggle your toes, roll your ankles, point and flex your toes, and point and flex your knees. Good, and stand up for me, please. I'm just gonna have you rotate your hips outward. Perfect, and then inward. Perfect, you can stay back down. Full range of motion of the lower extremities. I'm now going to assess for strength. So just push against my resistance just as you did in upper extremity. So push out, in, down, up. Perfect. And I also just remember that I don't think I checked your turgor in your upper extremity, so I'm gonna do that real quick. Okay, so perfect. I do not see any tinting, so hydration status is good. I am going to assess your sensation in your legs. So just close your eyes and you can tell me whenever you feel this.
Yep. 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 Yep.
Yes. Perfect. Sensation of the lower extremities is noted. And I'm going to take a look at my paper real quick so you can just stay seated, okay? Okay. Okay, so at this time, I would normally do a breast examination. Do you usually do that at home?
I do not.
Okay, so what I would have you do, if we were to do it here, is I would have you lay with one arm up, and I would place a pillow under your scapula, and I would inspect for size and symmetry, just as you would at home. I would then palpate all 4 areas of the breast up into the talus sphinx. You can do this in either in the shower or lying in bed. And there are 3 positions to bring about dimpling. So you can have your arms straight to your side, on your hips, or all the way up above your head. And then I would just suggest that you would do this once a month, about 5 to 7 days after your period. And like I said, you can do this in the shower or lying in bed. And you would just palpate all 4 regions of the breast and up until the tail spins.
Okay.
Any questions?
Nope.
Okay. And if you were a male, I would inspect I would inspect the penis and the scrotum for skin characteristics and hair distribution. I would then palpate the penis for any pain, tenderness, or masses. I would then inspect the meatus for its location and if there is any discharge. I would then also palpate the vas deferens, testes, and epididymis for size, location, any tenderness or masses. And then I would also suggest that you do this once a month. You can do this in the shower or in front of a mirror. And if you notice any changes at all, that you would immediately report that to your doctor.
Okay.
And as I was going over, I noticed that I did not state that your hair was evenly distributed, so healthy hair. And to end this, I will ask you about how many times do you think you've urinated today?
3.
Okay, and do you know when your last bowel movement was?
This morning.
Okay, perfect. So I'm just going to take one more look at my paper, and then we'll be done. Okay, so throughout this examination, you were responding appropriately and reasonably to all my questions and commands. Your speech was clear and understandable with a moderate pace. And just one last thing, I assessed your sensation of your lower extremities, but I did not in your upper extremities. So same thing, just close your eyes and let me know when you can feel this.
Yep. 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 Yep.
Okay, perfect. Thank you, Ms. Drummond. And that concludes our head-to-toe physical assessment.
Awesome. Thank you.